thank Dr. Hussein Nokat and everybody at Asyut University for a fantastic symposium. Really, here in Egypt, we've gone from the oldest and the biggest to the newest and the smallest in surgery. And it's a wonderful journey, and I think everybody at Asyut made this a truly memorable occasion. Thank you.
Okay, so I'm going to take away my surgeon's cap right now, and I'm going to put on my cap as in another capacity. Because over the years, over the last 15, 20 years, I've been editor and associate editor of a number of journals. Some of these journals you might know. The Interactive, the sister journal of the European Journal of Cardiothoracic Surgery, I'm the associate editor for thoracic papers. So for the last 10 years, any thoracic paper you see in this journal came through my inbox. I'm also the editor-in-chief of a new journal, the Journal of Visualized Surgery, which some of you may have heard of. It's now Medline Index, and we're waiting for an impact factor later on. But I also work in the editorial board of I don't know how many journals. Right now in my email, I'm a reviewer for Annals, for Chest, for everything. I've got a few papers I've got reviewed for Annals that I'm already overdue for. I was Reviewer of the Year for the European Journal of Cardiothoracic Surgery for 2 years running. So I'm saying all this not to boast, but just to tell you I know what I'm talking about. So I'm just going to share with you a little bit about the trends in the thoracic surgery literature, because some of you here in this audience will be keen to publish your papers, and a lot of you will be disappointed when you get rejected, and I'm just going to tell you why. Now, this is the good old days. So when we were younger, when I was a resident, if you wanted to publish a paper in thoracic surgery, there were only a few journals out there. Today, the situation is a lot more complex. There are a lot more journals out there that deal with thoracic surgery. Now, you would think this is great. There are more outlets for me to publish. The reality is not so straightforward, because with more journals, you're noticing two things. One is what I call the stratification of journals. Right at the top in our specialty, we have JTCVS, we have Annals, we have European Journal, right at the top. But underneath them, we're seeing a lot of newer journals, Journal of Thoracic Disease, Interactive, a few other second tier. And then below that, you have other journals as well coming up. Now, every journal and every tier wants to move up. They want to become the big brother. And to do that, they're competing against each other, especially in terms of impact factor. We'll come back to that in a minute. So there's a competition between journals against each other, climbing the ladder, trying to fight each other off. And so they're very selective. It's actually getting more difficult to maintain position. Now the other thing is, the demand for publication today is growing much faster than the number of journals because of countries like here in Egypt, and in Turkey, and in China. We're the countries, in the developing countries, that suddenly over the last 5–10 years, we're doing a lot more good work. And we want to be recognized for it. Let's be honest about it. We want to be recognized in the thoracic surgery field. And this is the field that's been long dominated by Europe and America. So there's a lot of publications going to the top few journals, and it's actually getting very, very crowded. So ultimately, when you put it all together, it's more difficult today to publish a paper than it was 15 years ago. I can tell you that. 15 years ago, I can get rubbish published in the European Journal in chest. Today, it's very difficult. I do a very good systematic review or randomized trial, and I can tell you it's a hassle getting it published. Now, what is all this about? It's all about one thing. Journals want citations. The way they climb the ladder and compete against each other is through impact factor. Now, there's a lot of people saying, oh, we shouldn't pay attention to impact factor. It's a waste of time. They tell you that, but behind the doors, everybody cares about impact factor. Now, impact factor, in case you don't know what it is, it's the number of citations in that journal over the last 2 years divided by the number of articles published in that journal over the last 2 years. Now, what that means is if I want a good impact factor, I either get more citations or I accept fewer papers. Now, the top journals in thoracic surgery are doing a very good job, okay? Now this green line is JTCVS, this red line is Annals, This is the European Journal, and this is the ICVTS. And over the years, they compete against each other. Journals like my own, we're doing quite good. We're increasing our impact factor year on year. And we're doing that exactly using that calculation I showed you. Now look at ICVTS. We've gone from 1.15 to 1.3 to 1.9 almost in just 3 years. Now how do we do that? Yeah, we increase the citations, but not always. This year we didn't do so good. But the one consistent thing is that number underneath. Every year we're reducing the number of papers we accept. And even if we're getting a similar number of citations, our impact factor is going up. And what you're seeing, okay, is that the way we do it is we get very careful analysis of what articles are being cited. Now this is the EJCTS. Now what you're seeing here is these are the journals that get 0 citations. These are the journals that get 5 or more citations. So for the journal, we want more papers like this. We don't want papers like this. We want to get them out of our journal. We want more papers like this. It's the same in ICVTS. We're not doing too bad. We're getting some papers with more than 5 citations. If we publish only these papers, our impact factor would be over 5. Very good. Unfortunately, we have to get rid of this. Now the good thing is, we have very good tools to tell us which papers get cited the most. Now this is the EJCTS. Now the ones in red are the really lousy types of papers. The ones in green are good. Now far and away the top papers that are cited are guidelines. Because groups like the EACTS and ESTS, when they have a guidelines, they publish in the European Journal. And these papers are cited over and over again. So we love guidelines. We love original articles, okay, and sometimes good systematic reviews are also good. But the ones that are really bad, are case reports, surgical technique papers. It shows up even more in the ICVTS. This green one, state of the art. These are very focused review papers. That's good. This best evidence topic, systematic reviews are fairly good. But what's really lousy, case reports. They do terrible. Let's see, where are they? Some of the are technique papers. I don't know where it shows up. Technique papers never get anything. Procedure, 0 citations. So if you have a paper saying, look at my surgery, I do great, this is how I do it. People might read it, nobody's going to cite it. So these papers are poison. Now, overall, you can see year on year, we're increasing our impact factor because the acceptance rate goes down. Okay, this is ICVTS, same thing. We're doing very good. Even if you submit to ICVTS today, our acceptance rate, I don't know how it shows up there, is fairly low. It's sort of in 20% or 20-30%. It's actually getting lower year on year. And it's going to be very difficult for you guys. But we're also focusing on the types of articles. Now this is EJCTS. Now these are original articles. Introduction, method, results, and discussion articles. The next most submitted category are case reports. Now pay attention to these two. These are the number of papers being submitted. And these are the papers that are being accepted. Suddenly, case reports drops almost nothing. Because we know these papers will never get cited. Original articles are better than case reports, but there's still a big drop-off. Now the one that actually, okay, this is flip back, the one that actually rises are these papers here. These are review articles, not normal reviews, but we're lumping together meta-analyses and meta-analyses and systematic reviews into here. These go up. We know which articles are going to get us citations, and we do it accordingly. Forget this. This is letters to the editors. Forget that. Now it's the same thing in ICVTS. Everybody's submitting original articles to us. They're submitting case reports to us. This is the submission rate. Look at the acceptance rate. Boom. Case reports goes to nothing. Okay? Even original articles comes down. Now where have the papers gone up? Work in progress. In ICVTS we have a category where if you're doing a study, you haven't finished it yet, but it's breaking news. These are exciting topics. We love those. We love things like best evidence topics, state of the art. These are systematic reviews. Done correctly, these get lots of citations. And that's why the acceptance rates on these go up. So overall, just to summarize everything, that case reports, surgical techniques are poison to every journal. Don't even bother sending it to me. I tell you now that in the ICBTS, my acceptance rate for case reports is way under 10%. Don't even bother. Okay. What I want are meta-analyses, systematic reviews, guidelines. So if the Egyptian Society of Thoracic Surgery has the Egyptian Society guidelines on how to do such and such a surgery, send those to us. Because these are papers that always get cited. If you're doing an original article, experimental articles always do better than clinical papers as well. And that's what we like. Now, with this in mind, if you're trying to write a type of article, do I have any tips? I do. Now, we said reviews are good, but not all reviews. If you say, I'm going to review that's thymectomy. That's too broad. Everybody's done it. There's no way you can write one article that will interest anybody. The only way you can get a review accepted nowadays is, number one, pick an interesting topic. Something that everybody has some interest in. Lung cancer, pneumothorax, common topics. But within that, you don't want to review the whole topic. It's too big. You need a few textbooks for that. You need to pick a focused question within that topic. Okay, here's lung cancer, but I want us to know specifically with this type of lung cancer, this type of patient, with this kind of surgery, what happens to this outcome measure? A focus. You need to focus. What do we not know about that particular thing? What should we know? And then you review it. Ideally, you want a method. It's not the old days when you just sort of review of the literature. Nobody wants that anymore. What you want is a good search strategy, a good selection strategy of the papers you have. Do a systematic review. And if you can do that, you have a very good chance of getting your review accepted. Now, what about original articles, the introduction, method, results, and discussion type of articles, IMRAD articles? Now, we talked today already about the evolution of evidence. So this is for VATS. Now, the evolution of evidence is like the evolution of the iPhone. If the latest iPhone is out, nobody's going to buy an early version of the iPhone. It's the same thing with evidence. If we've already moved on to here, no journal is going to accept evidence over here. Forget about this. So I'll give you a few examples of that. Something relatively new, like ENB. This has been out in chest physician territory for years. In thoracic surgery, this is fairly new. In fact, it's only over there, sort of in the infancy. Today, if you do it right, you might still get some case series published on this topic, okay? So that's not too bad. What about something like uniportal VATS? Relatively new, but unfortunately, thanks to this guy, he's published so many case series that he's taken us away from infancy already. Now, we're already in this childhood phase. At the moment, there are comparative trials showing you crude benefit of uniportal versus conventional VATS, but it's lousy evidence. So if you have good comparative studies, you might still get it published. If you have objective measurements, like the cytokines we were talking about, you will definitely get it published. But if you send me any more case series, I'm going to reject it without review. I'm telling you now, okay? Forget it. There's no interest. Now, what about a topic like conventional VATS? This has been around 25 years. It's been hacked to death. And sadly, we're already way past adulthood. Way past it. So if you want to get a paper published in this, good luck. It has to be a damn good paper. Like that Lancet Oncology paper I showed you earlier. If you do a big, good, randomized controlled trial, yeah, maybe. Otherwise, it's really, really difficult. So that's the effect of impact factor. Now, what about case series and case reports? Everybody wants to publish these. And you always think, I've got a really interesting case. You've got to hear about this. Unfortunately, to editors and reviewers, nah, not really interesting. One of the things that people always think is that, I've got a very rare disease, or I've got a very rare complication. I have to tell it. But unfortunately, rare is not interesting. I'll come back to this a little bit later on in the second talk. Rare is not interesting. What you really need to show if you have a case series is there any new presentation for this disease? You've got this disease, I know it, but is it presenting in some new way that nobody's ever heard of, that people should know about it? Do you have a new way to treat that same disease that nobody else has thought of? Or are you treating it the same way, but do you have some new outcomes, some new insights that nobody's ever heard of? And if you don't have any of these, and all you have to say is, this is rare, forget it, I'm not going to accept it, okay? So that's case series. Now, there's good news. If you do have these case reports, journals have evolved. At the bottom tier of journals, we're seeing journals that cater for these areas. Open access journals. You have to pay to get published. Okay, good. If you have the money, pay to get published. It's almost guaranteed acceptance. And these journals, crazily enough, because they're open access, they have very high impact factors. That's the good news. You pay not only for publication, you pay for good impact factor. There are journals that cater specifically for case reports. And there are also journals that cater for techniques and videos. Now these are the sort of garbage can of papers. If you can't get your paper published anywhere else, these will probably take it. Sadly, one of my journals is in that category, but we're trying to do better. We're much more selective. We do peer review all our papers, so we're trying to aim better. But if you do have a surgical technique paper, and you know the Annals is not going to take it, JTCVS is not going to take it, maybe we will. Okay, so you can aim for different types of journals. Now, the journals themselves, there are a few trends. Journals nowadays have very sophisticated software. Before a journal ends, a paper ends up in my inbox, the editorial office has already done a duplication check, and will see if you are plagiarizing or copy and pasting papers. So don't do it. It's so easy now for any journal to find out. And if that happens, at the worst, your university or hospital will get notified and will be blacklisted. We now give a lot more sudden death. If I see a paper, like a case report, I don't even send it to reviewers. I reject instantly. Poof. I'm not even going to consider it. Sorry, get out of it. And the other thing that's important is that all our reviewers are being graded. Every time I, as an editor, get a paper, I send it to reviewers to give me a review. We actually give the reviewers a grade. Now, some of you here are reviewers. Do you know that you're being graded? Probably not. I grade each and every one of you. So I can tell how good your reviewer is. Now, this has the natural selection effect, okay? If I see that you're doing crappy reviews, I'm going to pick you out, I'm going to check you out. You're never going to review for this journal again. Never. The good reviewers remain. And eventually, we have a pool of reviewers for each journal that suit the editor. Now, that has an interesting effect on papers, because these guys, for some strange reason, might favor a certain type of paper, a certain type of topic. So if you are an author trying to write to a journal, if you want to have an idea of whether you'll be accepted or not, look at the track record, okay, of that journal over the years. What kind of papers has this journal been rejecting or accepting? And you have an idea of how likely you are to get a paper accepted. Now, here's an example. Just take an example, for example, uniportal VACs. If you look at the American journals, American surgeons hate uniportal VACs. They've published a handful of uniportal VACs papers, and that's about it. The vast majority of these uniportal papers are published in European journals or ICBTS or other journals. Okay? And this will give you an idea of what certain journals like or dislike. So that's one thing to pay attention to. Now, the last little message I want to share with you before I finish this particular talk is, this is sneaky, okay? It's the countries. And this matters to you and me, because we don't come from Europe and we don't come from North America. We come from countries like China. We come from countries like Turkey, India, okay? What else do we have here? Poland, developing countries. Now, the good news is, in terms of submitting countries, we're not doing too bad. Turkey's over here, India's over there. China is submitting a lot of papers. But look what happens when we look at acceptance rates. Same journal, same year. Suddenly, China went from here, it dropped all the way to here. The acceptance rate is less than half of the submission rate. And what happened to Turkey and India and Poland? They're not even on this map. The developing countries are not getting published. Here's the ICBTS, same story. China is #1 in the world. Between China and Japan, we're submitting 35% of all the article submissions to the ICBTS every year. Huge amounts. But when you look at the acceptance rates, wow, China goes down to here. Turkey and India, gone completely off the face of the map. Now, why is that? Now, this is another thing that might give us a clue. Maybe it's to do with quality. Now, this is a chart of the volumes of scientific publications in a year. There's America way over there. This is China, not doing too bad. You're submitting a lot. But this little blue, light blue line here at top, these are the top 1% of cited articles in the world. And countries in Europe and in North America, they're being cited much more than their fair share. Whereas from Asia and Africa and other countries, although we're getting some publications, they're not being cited. They're being seen as lower quality papers. Now, there's two ways to look at it. This is one way to look at it. This is from a Chinese journal. And they're very cynical. They say, if you're a Western guy publishing in English in a Western journal, people will worship you. If you're a Chinese guy publishing Chinese in the same article, nobody's going to care. Maybe it's racism, who knows? Could be. But there's another way to look at it. And from an editor's point of view, there really is a quality gap, okay? Now, there's a few things that I've noticed I just want to share. These are just personal thoughts. The first is from a lot of developing countries, including here in Egypt, including even Turkey and China, we don't have a good system of patient follow-up very often. We do have some sort of follow-up, but nothing is systematic as what they might have in the NHS or in America. They have very good databases. And that's what we need to establish in the developing world. If you don't have prospective databases, anything that we publish is not going to be convincing. You don't have the data to show answers to the clinical questions you're asking. The other thing is, if you notice, a lot of the papers that are being published from the developing world countries tend to be case series, where we have lots of numbers, okay? You might say, I've done more, let's take an example, hydathic disease than anywhere else in the world. And it's true. You know, in this corner of the world, you have a lot of that. And you might think that if I publish a paper on the 5,000 hydathic disease cases that I did, it would get accepted into New England. Sorry, it doesn't. Because all it says is, I am great, look at me, I've done so many cases. It doesn't answer a clinically interesting question. You need to translate numbers into actual practical solutions. And therefore, I think one thing that we're losing out on is asking the right clinical questions. The reason those European guys, with their tiny little cohorts, are getting these great papers being published is because they know how to ask the right questions. And when you ask the right questions, you get the right answers, your paper will get accepted to the best journals. That's the key. There's one last thing I want to share with you, is that a lot of people think, it's because my language isn't very good, my English is bad, that's why they rejected me. That's not true. You get rejected sometimes for cultural differences. We have a saying in China, it's like a duck talking to a chicken. You're talking different languages. It's not your language is bad. It's that your core beliefs sometimes are different. Let's take an example. The Japanese, they're very good nowadays at getting their papers published in lung cancer. So we're talking about Naruki. So when you're talking lung cancer, the Japanese know how to speak lung cancer in English. What you will never find in the international journals are Japanese papers on pneumothorax surgery. Go look it up yourselves. There are very few, relatively few papers. The reason is, you know how the Japanese do their pneumothorax surgery? They just staple the blood. There's no pleurodesis. There's no pleurodesis. Recently they've changed a little bit, but they've never done it. So every time the Japanese submit a pneumothorax paper to a major Western journal, the reviewers go, what the hell is this? I don't understand it. It's gone. There's more. There's political correctness. We have different ethical considerations. For the Annals of Thoracic Surgery, the American journal, I once rejected a paper from China because they were talking about needlescopic surgery, and they happened to say that because it is cosmetically better, young females who enjoy beauty will enjoy the surgery more. Now, in China, you might get away with that. But to an American female surgeon who's your reviewer looking at that, forget it. Instant rejection. And that's purely because of cultural differences. And the only way we're ever going to get across that gap is to have more engagement. So I encourage everybody here in this room, I know it's difficult, but the more you actually get over to Europe and America and exchange with our peers, the more easy it is to see from their perspective what they find acceptable or not. And unfortunately, they still control all the top journals. So Conclusions. I think impact factor will influence the acceptability of different types of papers. If you're writing different types of articles, you have different strategies to submit, like we just said. Journals themselves evolve, they select reviewers, etc., and that affects their direction. And last but not least, for those of us here in this room who come from developing countries, we need to adapt specifically. We need to understand why the journals are rejecting a lot of our papers, and hopefully we'll do better in the future. Thank you.